bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive. All right, hello everyone, and welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Paediatric Health Centres. And today we're going to talk about Paediatric Project ECHO, empowering healthcare professionals to provide the right care in the right place at the right time. And Project ECHO is an innovative model for medical education and healthcare delivery that expands access to pediatric care. And it's just one of the many things we like to talk about here at CAFC Presents as far as helping healthcare providers, patients, families, administrators get the right information that they need to improve care for children. There's so much information out there that lots of folks, like the people we have today, are bringing their innovative strategies to get that right information and to make it easier for people to find the information they need that's going to help improve care for their patients. So without any further ado, it's my pleasure to introduce our two presenters. First, we'll have Dr. Adam McKillop, who is the project manager for the Pediatric Project ECHO at SickKids, and he's also on the SickKids Innovation Acceleration team and participates in other projects that aim to reimagine pediatric care models. And joining Dr. McKillop is Annie Juwan, who is the education coordinator for the Pediatric Project ECHO at SickKids, both of them, of course, at SickKids, the Hospital for Sick Children, which is in Toronto, Ontario. So it's my pleasure to hand the virtual podium over to you, Dr. McKillop.
Great, thank you very much. Good morning, everybody. Thank you for attending today's webinar. It's our pleasure to have the opportunity to share this topic with all of you. And thank you to CAFC for hosting us as part of the CAFC Presents webinar series. So during today's talk, I'll be giving a presentation really around the background for Project ECHO, including a brief history and overview of some of the existing programs in Canada. After my presentation, I'll be actually leaving a little bit of time for questions specific to what I present. And then Annie will be taking over and presenting really the educational components or the nuts and bolts of our program and what's involved, as well as our research and evaluation plan. And we're also going to ensure that there's time remaining to discuss anything from our presentation and definitely answer any questions that you may have. So to start out, I'm just going to give a background for Project ECHO. It is an acronym, so it does stand for Extension for Community Healthcare Outcomes. And really, it was created to address a problem that is potentially very well known amongst the audience here and perhaps all too familiar, which is outlined in this figure. Really, patients require specialty services to manage complex, chronic, and common health conditions. However, there aren't enough specialists to meet this need, and this is especially the case in rural and remote areas that are often medically underserved communities. Project ECHO aims to build capacity in the community through mentorship and collaboration, really by sharing best practices and exchanging knowledge. This is achieved using video conference technology to connect the specialists with community-based providers on a regular basis using case-based learning. So really you can think of the main ECHO model being around virtual grand rounds. The ultimate goal is to provide patients with the right care in the right place at the right time. And we may also actually add that it needs to be also by the right person. So when this person may be someone who received some specialty training and acquired some new specialty knowledge by participating in Project ECHO. So Project ECHO actually started in 2003 in New Mexico, and it was with Dr. Sanjeev Arora, who was a liver specialist, who worked with a large hepatitis C population. What he realized was that patients were driving hundreds of miles to see him, yet he recognized that many of these patients could be cared for in the community. This would be saving the patients and families time, money, unnecessary stress associated with travel and meeting these appointments. In order to address this problem, Dr. Arora started a free virtual clinic to connect with the community-based providers to really coach them through how to care for the hepatitis C population in the community. From this is where the ECHO model was really born. So the ECHO model is built on a hub and spoke structure. So an ECHO hub is composed of an interdisciplinary team typically located within an academic health center. This team includes specialists that have experience in a given area. A spoke can include one or more community-based healthcare providers who participates with the goal to gain specialty knowledge from the hub team. So community-based providers may include any healthcare profession or allied healthcare profession and may become a more local resource for this area. So the diagram on the right really emphasizes and highlights what this model is trying to achieve, and is referred to as force multiplication, meaning a spoke site that may be participating in ECHO becomes a local resource with this specialty knowledge. The learning in this model is bidirectional. So by that, really what we mean is, as much as the spoke site might be learning about specialty knowledge from the hub team, the hub team is going to be learning very important information about what's happening in the community and what are the community needs, what are the gaps in medical care that the community may be facing, and how can the hub team support the community in that regard. So there really is interspoke learning as well, which is really community-based providers that may be spread out across the province or across Canada. They can be learning from each other about what resources they turn to, what worked, what didn't work in their specific community setting, as well as really educating the hub team as to what the community needs are that an urban provider may not fully appreciate what is happening in the community given their day-to-day structure. And really what the force multiplication model is trying to achieve is that spoke now becomes a hub, whether that is a formal hub as part of the ECHO model. It's unclear if that would be the case, but really what they're trying to do is build the capacity so that spoke who participates in the program becomes a more local resource that's a little bit more in tune potentially with the local environment and the other kind of smaller communities that they can be servicing. The ECHO model does differ from traditional telemedicine. So the top portion of this diagram outlines the ECHO model, which is really an interprofessional team at the hub connecting with community-based providers. Participants learn from the hub and can apply this knowledge to their practice, whether that's one individual provider who's participating who can apply it to their practice, or potentially you have a whole family healthcare team sitting in on the call, and every member of that team is learning from ECHO, learning from the hub team, learning from each other. They take that knowledge and they can apply it to that many more patients. So this model allows for numerous providers to apply their learnings from ECHO and reach even more patients who require specialty care. On the other hand, traditional telemedicine, while still very highly valuable and necessary, is typically between a single provider and a patient, where the specialist is managing that patient remotely. There is a patient-provider relationship that is established. They're maybe a little bit more familiar with the entire patient case and scenario and family history and so on, whereas the ECHO model partly removes that patient-provider relationship and truly is built on a medical education model through case-based learning. So the ECHO model is able to make an impact at the patient, provider, community, and systems level as displayed in this figure. So I'll walk you through this from left to right here. Firstly, patients and families are able to receive specialized care, and that's really what this whole model is trying to achieve, to ensure that the patient's receiving the care, like we mentioned, at the right care, the right place, the right time. Community-based providers can acquire new knowledge and in many cases begin to provide care within their full scope of practice. So we may have different professions who are practicing in a limited capacity right now, and by increasing their specialty knowledge in their current practice, they're going to be able to manage and care for patients that require some more complex needs. And by learning through ECHO, they can actually apply that knowledge and begin to practice well within their scope in a specialty area. Patients are able to receive care in the community with a familiar provider, so they don't need to travel far distances, and providers are more likely to remain in the community to continue caring for their patients that do require that specialty care. At the system level, the ECHO model increases access to specialty knowledge for providers, increases access to specialty care for patients, and also helps improve the quality of care delivered by sharing best practices. So by somewhat standardizing the best practices across the different communities based on the ECHO model and the hub team's expertise, we start to really spread the best practices so everyone is starting to be on the same page in terms of how some of these patients should be managed. So we wanted to provide a little bit of context regarding really the scale of Project ECHO. As I mentioned, Project ECHO and the ECHO model originated in New Mexico, in Albuquerque, just in where the red oval there is on the slide, right in close to the middle of New Mexico. And it really only solely focused on the hepatitis C population at the time. What this map shows is the different specialties now using the ECHO model and the sites participating in Project ECHO in New Mexico. So each color represents a different specialty area and the site practicing that specialty area. So including dementia care, diabetes care, HIV and AIDS support, among others there. This map shows the global growth of Project ECHO well beyond the borders of New Mexico. There are now more than 120 hubs covering more than 60 conditions in over 23 countries and growing. I'll highlight the main difference with this map versus the last map I showed you of New Mexico is this shows the hubs and the super hubs. So the hubs is that multidisciplinary team of specialists at a given academic health center. And the super hubs is where different sites will go to get trained on how to implement and replicate the ECHO model for their program. What it doesn't highlight is the reach of each program. So this isn't as colorful. It doesn't have all of the different sites who have been participating in ECHO in any way. So you can just imagine kind of what this map of the world would look like if we actually layered on all of the different sites who have been touched by the ECHO model, who have learned from the different specialists to really start to build capacity in all of these different communities. To further demonstrate the scale of ECHO, the goal of Project ECHO under the leadership of Dr. Sanjeev Arora is to touch 1 billion people. So given the slide around the difference of telemedicine and the ECHO model, by reaching more providers in a virtual community of practice, and therefore those providers reaching that many more patients, what they're trying to achieve is that 1 billion people are reached by the ECHO model. So there are currently active ECHO programs in Canada and mostly in Ontario. So it did start at the University Health Network, was the first ECHO in Ontario, starting with chronic pain. UHN has since expanded to include rheumatology and hepatitis C. The Center for Addiction and Mental Health, they launched with mental health and addiction as their first ECHO, and just recently launched a First Nation, Inuit, and Métis wellness ECHO as well. The University of Montreal also just launched recently a hepatitis C ECHO, and these 3 programs really are adult focused. So while the Center for Addiction and Mental Health at CAMH, or the Mental Health and Addiction ECHO at CAMH, does potentially include youth cases because it is across the lifespan. In large part, these 3 programs at UHN, CAMH, and University of Montreal are adult-focused programs. For pediatric-focused programs, the Children's Hospital of Eastern Ontario launched the Child and Youth Mental Health ECHO in February 2017. It's seen great uptake and interest. They just started their kind of second cohort of participants just last week. Holland Bloorview recently participated actually in a research study and was one of the Canadian sites, and it ran an autism ECHO. And right now it's really hoping and planning to continue this program moving forward beyond that research project. So Pediatric Project ECHO is the SickKids ECHO, and it includes 4 pediatric specialty areas: acute and chronic pain, bariatric care, complex care, and palliative care. And the palliative care program is co-run with the pediatric palliative care program at CHEO. So Pediatric Project ECHO, really, when you look at this, it is 4 different ECHO programs being run under the umbrella of Pediatric Project ECHO. So the main goals for Pediatric Project ECHO is partly to evaluate the application of the ECHO model within the pediatric setting in Ontario. As I mentioned, there's been great success in the adult realm with the ECHOs over the last 3 years or so, and it's still relatively understudied and under evaluated into how the ECHO model can be applied in the pediatric setting. We want to support the Ontario Ministry of Health and Long-Term Care by producing data to replicate ECHO in other pediatric chronic conditions. So by launching 4 pediatric specialty areas through Pediatric Project ECHO, we're hoping to collect a lot of data that can support ECHO in other conditions as well. Because the ECHO model really did start with the University of New Mexico and the ECHO Institute in Albuquerque, we want to foster an ongoing collaborative relationship with the University of New Mexico so that we can continue to learn from their successes and their lessons learned in applying other ECHO models across the world. A large component of our project, which Annie will also describe, is really to promote the interdisciplinary collaborations, specifically to support health outcomes research and developing education. This is the core team for Pediatric Project ECHO. So the lead for this is Dr. Jennifer Stinson at SickKids. Each of the areas has a team of medical leads, which are listed here. And something I will highlight really is the physician involvement. So each of the medical leads for each of the 4 programs has a strong kind of champion in this way to drive this model forward and really support it in their own networks, and really exemplifies kind of the need for physician leads and leadership to champion medical education initiatives like ECHO to reach a greater audience. At the bottom part of this graph is really the operational team. We do have a dedicated research lead on the project as well that's looking at the research and evaluation component of it, and then the operational team there to support kind of all of the moving parts that the project requires. So at this time, I guess it might make sense if there's any questions regarding kind of the background of ECHO and the ECHO model, and if anyone had any questions or if you wanted me to clarify anything at this point, and then we can prepare Annie for getting into the education part of the presentation.
All right, so if there are any questions out there, we don't have any that have been typed in yet, but if anybody is quickly typing anything for Dr. McKillop, just based on what he's presented now, there certainly will be time at the end for sure. If you do think of something, we will certainly come back to questions for both of our presenters at the end. But it doesn't look like there's anything right now, so we can move on to Annie.
So thank you, Adam, for setting the stage. So now I'll more specifically talk about the education and research components of the Pediatric Project ECHO program. So as Adam touched on, Pediatric Project ECHO will be focusing on 4 specialty areas. The first one of that is acute and chronic pain. The second one is bariatric care, which is the treatment of obesity. The third one is complex care, which are children characterized by high service needs, severe chronic and life-threatening health conditions, functional limitations, and high healthcare use. And the final one is palliative care, which focuses on improving the quality of life of patients and their families facing the challenges associated with life-threatening illnesses. So these are the 4 areas that our ECHO, the SickKids one, will be focusing on. There are a couple of different offerings for each of the 4 specialty areas. So each specialty will offer a tele-ECHO clinic component and a core competency curriculum component. So that's number 1 and 2 on the slides. So a tele-ECHO clinic is a 90-minute session that will contain a short presentation on a specific topic and a discussion of a de-identified patient case. And the discussion is sort of similar to medical rounds, where someone will bring in a case, and as a group, you discuss recommendations and potential treatment options. The goal of these sessions is to enable community healthcare providers and specialists to work together to develop care plans that reflect best practices and ultimately in order to create a community of practice. The second type of offering that we will be providing is the core competency curriculum. So that's 8 hours of education that focuses on exploring complex topics in more depth than what is discussed during the tele-ECHO clinic. You can think of this more as a traditional lecture type of presentation, as it primarily contains a longer presentation and time for questions and group discussion. And the 8 hours of content, it's not all at once. It'll be broken up into 1 and 2 hour chunks and delivered over video conference. So what's interesting is that the core competency curriculum is a unique SickKids offering. So none of the other global ECHOs have done this before. And we've decided to do this because some of the presentations in the clinic can be quite short. And if we want to really get into the nuts and bolts of something a little more complex, we thought this might be an interesting forum to do that in. And both the tele-ECHO and the core competency curriculum are over video conference, so you could attend these sessions in the comfort of your own office or wherever you may be. The third type of offering, and so this is for only this pain specialty, is a boot camp. And this is a 2-day in-person boot camp that'll be held at SickKids, and it'll focus more on hands-on types of skills. So it'll be more workshops, learning techniques, that type of thing. And participants can take part in any of these 3 offerings for any specialty. So for example, you can attend the pain tele-ECHO clinics. You can also attend the bariatric care tele-ECHO clinics. You can do that, also attend the boot camp. You can attend how many sessions you want or as few as you want. It's really up to you to tailor how you want to learn using ECHO. And all of these programs are CME accredited and are for free. So you don't have to pay anything to take part in our program. So before I talk about the actual content in the program, I wanted to mention that Pediatric Project ECHO is a 2-year demonstration project and will have 2 phases. The first phase, which will be in the first year, will be focusing on centers and sites that already have experience in the specialty areas or have existing programs. So these are more clinicians or professionals who already have practice with pain, bariatric care, complex care, and palliative care. And in our second year, we'll expand our outreach and focus more on primary care providers and remote medically underserved communities. As a result, given the different audiences, the content in the first year will be more advanced, and in the second year, the content will be a little more broad. And the reason behind this is that we are sort of building up capacity for the program and creating a strong program before expanding out to target a wider audience. So to inform the content of our program, our team conducted a needs assessment to gain a better understanding of our audience, the topics that they are interested in, and their preferred delivery formats. To do this, we distributed an online survey via targeted emails to professional networks, associations, and allied health organizations related to each specialty. And in total, 91 healthcare professionals completed the survey. And I'm going to walk through some of the high-level results from that. So as you can see from this graph, we had a variety of people fill out our needs assessment from a very diverse group. So we have a lot of clinicians, we have a lot of dietitians. In addition, we have social workers, registered nurses, psychologists, physiotherapists, a pharmacist, an occupational therapist, a nurse practitioner, as well as a kinesiologist and exercise counselor fill out our survey. We had a couple of other people as well. So these are some project managers and project coordinators who are also involved in this. And it's quite a very interdisciplinary type of team, which was something that we were hoping for in sending out the needs assessments. Looking at this further, most of the people who were surveyed had greater than 10 years of practice, and they were from urban or suburban areas and academic hospitals. And as I mentioned, because this is the first year of our project, it's phase one, this was in line with what we expected because we did target a lot of the existing programs and advanced sort of sites in sending out our needs assessments. From the 91 people who completed our survey, they were asked which specialty areas they were interested in participating in, and they were able to choose more than one. So 50 people were interested in bariatric care, 49 in complex care, 35 in pain, and 29 in palliative care. And depending on which specialties that they were interested in, they were then provided with a list of topics for them to indicate which one of those that they would like to hear about more in the ECHO program. And in general, participants were very excited about the program and were generally interested in all the topics we asked them about. But I will share the most popular ones, so the top 10 for each specialty. And we are planning to incorporate these top 10 into the content for our tele-ECHO clinics and our core competency curriculum. So the top 10 topics for bariatric care are the counseling approach, identifying community resources for patients, medical comorbidities, psychological screening and overview, obesity prevention, overall assessment of a child with obesity, sleep, specialized patient nutrition, motivational interviewing, general patient nutrition, and medical comorbidities, medical screening and overview. The top 10 for complex care include management of challenging behaviors in nonverbal children, nutrition in complex patients, social support and funding for the complex patients, transition planning, developmental review of a complex care patient, advanced goal planning, caregiver, health, and sibling support, management of constipation, pain and irritability of an unknown origin, and approach to sleep-disordered and sleep-disordered breathing. For pain, the top 10 were musculoskeletal pain, mind-body techniques, mindfulness, CBT, ACT, educational resources for patients and families, interdisciplinary approach to pain assessment and treatments, abdominal pain, headache, and mental health assessments. And for palliative care, it's helping family make difficult decisions through shared decision-making, introduction to pediatric palliative care, talking about death and dying with children and families, grief and bereavement in children, approach to counseling families, advanced care planning and identifying goals of care, general symptom management, depression and anxiety, sleep problems, and constipation. So as you can see from these topics, there's quite a bit of variety and it's quite diverse. And it's a good list and a good start for our program. So if you do participate in it, you will be hearing a lot more about these topics in greater detail. Our final question for the needs assessment was whether participants, what was their preferred delivery format for the video conference sessions, and it's whether or not they preferred shorter sessions versus longer sessions. So the majority of participants were interested in 1 hour sessions, so 1 hour chunks of learning, although we did have quite a number of people who were interested in the 2 hour sessions or even 4 hour video conference sessions. For the beginning of our project, we're primarily going to be doing 1 hour or at the most 2 hour sessions, just based on these responses. And there'll be a slightly different offerings for each specialty area. So some specialties will offer 1 hour sessions, some will offer 2, and it's just sort of based on the results that we got from the needs assessments. Next, I wanted to talk a bit about the research and evaluation components for Pediatric Project ECHO. And there will be 2 main questions that we plan on evaluating. The first one is whether Pediatric Project ECHO can be implemented as planned. And to answer this question, we'll be looking at the level of participation at the hub and the spokes. So this is for both the specialists and the community care providers, both of their levels of participation. The fidelity, which is defined as the extent to which Pediatric Project ECHO follows the typical ECHO format. So this is the format developed by the University of New Mexico, the first ECHO model. We're seeing whether ours follows the same format to that. As well as feasibility, which is the extent to which Pediatric Project ECHO can be delivered as planned. The second question looks at the performance-related outcomes of the ECHO program, and this is participant acceptability and satisfaction, the degree of comfort they have with the ECHO program, so the format, the delivery, the technology, whether they feel that this is a good session for them to learn from, they feel comfortable participating in the session, that type of thing, as well as knowledge changes related to the ECHO topics, so whether participants feel like they've learned something new from participating in the session, and self-efficacy, which is the degree of confidence that they have in the ability to manage complex cases. So basically whether or not participants feel more confident after taking part in the ECHO program. In future years, we do plan to measure things such as practice change, patient-related outcomes, and economic analysis, but for now we will be focusing on these 2 main questions. In terms of the study design, it's a prospective study, so it'll be using a mixed methods design with repeated measures. So we'll be primarily using surveys, focus groups, that sort of thing. And our evaluation model is based on Moore's framework, which is a recommended model from the University of New Mexico. Other ECHOs globally are using this model to evaluate their ECHO programs. And this model is also commonly used for outcome assessment for continuing medical education. The study sample will also include both specialty team members, so the hub, as well as community partners, the spokes. So both of those will be involved in our research and evaluation components. We're excited to announce that Pediatric Project ECHO is officially launching in less than a month from now, and each of the specialty areas has a different start date. So the pain group will be starting their ECHO in October this year, so October 2017. bariatric care will be starting for the OPBN network, so the bariatric network, in November 2017, and in spring 2018 for everybody. Complex care will be starting in January 2018, as well as palliative care will also be starting in January 2018. In terms of next steps, getting involved and getting more information about the project, registration is now open, and in order to register, you can contact project.echo@sickkids.ca, so that's our email, or you can give us a call at the number listed below. You can also find more information about Project ECHO at our SickKids webpage. So if you're looking for Pediatric Project ECHO in specific, it's sickkids.ca/Project ECHO. If you're interested in other ECHOs that exist in Ontario, there's also the Project ECHO Ontario website, which is echoontario.ca. So it has a listing of other programs that are already up and running that you can also attend there as well. And if you're interested in global ECHO initiatives or even starting your own ECHO project, you can contact the University of New Mexico and their website, which is at the bottom of the slide listed below. So that's echo.unm.edu. So that really concludes our presentation, and we appreciate everyone who's joined in and listened to us today, and also thank you, CAPC, for having us. Adam is on the line as well, and we're both open to having any questions, and thank you again.
All right, thank you, Adam and Annie. A great presentation, a really interesting project. I think lots of interest in having, particularly when you mentioned right off the top of the presentation, in rural and remote areas, having access to this kinds of expertise and meeting the needs of those children in their community is so important. So the first question that came in was asking, and this was back, it came in just as we switched over to Annie. Adam, this question was, I think, for you, related to what you were presenting. She was just wondering if you can provide an example of how the ECHO program has impacted care, particularly, and specifically from within a mental health example, if you could.
So I'm trying to think. So mental health isn't one of our areas. I think, based on some of the experiences in talking to project manager and the different coordinators through CAMH, was partly what ECHO is used for, is to connect the community-based providers with the specialists. And one of the great parts of doing that is to present a patient case who may otherwise be waiting a long time on a wait list to see a specialist for mental health. And that's where I think CAMH has really done an incredible job, and same with CHEO, is really trying to expedite some of those patient cases to get some information and get some knowledge that can be supported by the community provider, and especially with CAMH recently launching their First Nation, Inuit, and Métis ECHO as well, is really trying to shift focus to those communities that do require some additional attention and resources to help support their mental health services. In terms of like a specific example for mental health, I personally can't speak to that. I'm happy to, if it's possible to get the contact information, you can follow up and inquire with CAMH directly if you go through the ECHO Ontario website, and you can connect with the mental health programs through that.
Also, if you don't mind me jumping in as well, as Annie here, but one of the things I did want to add, just in terms of, I guess, outcomes with patients, although I don't think CAMH is measuring patient outcomes right now, a lot of other programs are doing that. And from what we've found, a lot of patients are, in general, very excited to hear that their patient case is being presented at ECHO, and they've generally had a very good response. So a lot of patients are excited to hear that their case is being looked at, talked about with a lot of clinicians, and overall people have been very receptive of that. And just in that itself, patients being thought of as being recognized and their case mattering, that has been very good with our program, and we've had pretty good reception with that as well.
All right, so there's a couple of questions here that are sort of related, just with respect to the structure of the project as it exists at SickKids. When you listed the team members, there were obviously, and you mentioned there was obviously a partnership with some others, including CHEO, the Children's Hospital there. Going back to the initial, some of your initial slides about the structure as far as the hubs and the super hubs and that sort of thing, would SickKids be considered the hub for Ontario? And if so, what's CHEO's role in there? Is it sort of a partnership in that sense, or exactly how does that work?
Yeah, no, that's a good question. So SickKids would be considered the hub, but really for the palliative care part of the project, the palliative care part of our project, SickKids and CHEO are co-leading that. So I think it's roughly I think it's about like a 70-30 split. So of all the program components, SickKids would be kind of leading and hosting 70% of them, and CHEO would be leading and hosting 30% of them. So out of the clinics and the core competency, it's going to be a shared responsibility between those two. And then otherwise for the other three programs, so bariatric care, complex care, and pain, those are hosted and everything is run through SickKids as the hub. And even though the slide that I listed there really only highlighted the core team of the medical leads for those areas, each of the four specialties has a hub team that is multidisciplinary. So on the pain team, you're going to have psychologists and social workers and occupational therapists and physiotherapists and so on. And for the bariatric care ECHO, you're going to have dietitians and exercise counselors and social workers and psychologists, physicians, endocrinologists. So it is kind of rounded out in that way. And then CHEO and SickKids are sharing that responsibility for the palliative care ECHO.
Okay, and that sort of leads into this next question, which was asking, just noticing that during your presentation, Annie, when you were talking about the different areas, when you surveyed people, what the different areas of need were within each of those four priority areas, they noticed that there's quite a large and varied list under each one, and she was asking, does SickKids feel they have the expertise in all of these areas, and is the plan to provide an expert speaker to deliver each one of those? As you're suggesting, at least with respect to palliative care, there's a partnership with CHEO to extend all that expertise. But for those other three areas, is SickKids able to do they have the expertise? I mean, quite certainly one of the larger, if not the largest facility in Canada, lots of areas of specialization. The expertise to present in each of those areas within, like those sort of topics of interest within those priority areas, like SickKids is able to deliver all that themselves?
So that's a great question. With the actual content and the topics, so most of them will be delivered by people at SickKids, but we will bring in external speakers for a particular topic that we think might be better addressed by someone coming from that area. For example, for a lot of like community-focused topics or interdisciplinary teams, we might reach out to a speaker in that particular field and area. And also, it's great having that diverse perspective as well. So between SickKids and the network that works with us as well, and other speakers from other areas, we will make sure we find someone who's able to provide insight on that area. So it's a bit of both. So SickKids is involved with most of it, but there will be other professionals as well speaking and at the sessions too.
All right. The next question is asking about if the hubs have connected with OCHRS, which is the Ontario Association of Children's Rehabilitation Services, which is a network of the children's treatment centers across Ontario. Just for those of you outside Ontario who might not be familiar with the children's treatment centers, these are organizations that provide sort of rehabilitation, sort of outpatient ambulatory rehabilitation, child development type services for patient populations such as cerebral palsy or autism or those sorts of things. But she's asking specifically with relation to palliative care and complex care cases. Have you connected with OCHRS or with the children's treatment centers?
So we have. So we've reached out to a fair number of different organizations. kind of spread the word and promote more or less the ECHO program at SickKids. And I think we are also interested in the upcoming Ochres conference in November and potentially contributing to that in some way. But we've reached out to a number of different centers that kind of support the child rehabilitation services side. And I guess whoever asked that question, feel free to reach out if we haven't maybe done a great job in specifically addressing some of the areas that you're interested in. By all means, contact us, because this was a group that did come up on our radar for sure, especially given the topics and the areas that we're covering. And we do want to reach out to as many of those services and different centers. So by all means, contact us if we maybe miss the mark in some area.
All right, and I think we are just about getting through the list of questions here, or we've gotten through the list that have already come in. So if anyone does have any last questions that they would like to ask, we do have about 10 more minutes left to take those questions, or we can wrap up early. I'm just speaking of conferences coming up. Ochres is coming up. I think it's in November at some point, but Adam is also going to be at the CAFC conference in Montreal on October 22nd to the 24th. I believe you're bringing a poster on this work. Is that correct, Adam?
Yes, that's correct. I'll just I'll mention that. So we actually have, so as part of the Project ECHO and ECHO Ontario, there is an ECHO Ontario collaborative. So it's the group of all of the existing ECHOs in Ontario that work together, or have been working together, really to pool resources and try to synergize some of our efforts. And we're doing more or less a conference circuit over the fall, which I'm sure a lot of people are familiar with. But so we will be the ECHO Ontario group, which will be presenting and kind of be present at conferences as a vendor or as a booth, not so much a vendor. We're not making money here, but as a booth to promote ECHO and the different programs. We're going to be at the Nurse Practitioners Association conference next weekend. We're going to be at the Ontario College of Family Physicians conference, the AFTO, so Association of Family Healthcare Teams Ontario conference, as well as a few others. So what we're trying to do is really go as a group to promote ECHO Ontario at some of these large conferences, and then for specific ones, like for the CAPC conference, for example, I'll be going and presenting a poster really highlighting our program at SickKids, the program at CHEO, as well as the program at Holland Bloorview, really kind of showing the impact that ECHO can have in pediatric care across the province. And the other ECHO, so for example, CAMH will be going to a few like mental health and addiction specific conferences. So you might actually see our group, whether or not it's Pediatric Project ECHO specifically or ECHO Ontario, be popping up at a few conferences over the next year.
All right, sounds good. So if anybody is at any of those conferences, I'm sure that would be a great opportunity to connect in person and learn more, or ask any more specific questions about the ECHO project. We just have a comment that some folks in the audience are saying it's nice to hear that you're open to being influenced by the community and accepting, the contributions from experts within the community that might be able to contribute to the ECHO project as far as lending their expertise to the training and education segments of it. So I think with that, that's the last question we have. So I think we'll hand it back over to Adam and Annie for if you have any closing key messages or comments you'd like to leave the audience with before we sign off.
I guess from my side, I just want to say thank you for everyone who's listened today to the presentation. I know it's really exciting for us as a team to have spent the last 9 months or so kind of planning on this project and finally getting to the point where we get to launch it in October. It's been very busy for us, as I'm sure a lot of people over the summer. Summers are no longer a time to just relax, it seems like. So summer's been busy, but we're really looking forward to getting the program up and going. By all means, you have the contact information on that final slide that Annie presented. So if you have any other questions, definitely reach out. We're more than happy to answer and get connected with the greater audience of who can help support our program.
All right. Well, thank you very much, and great presentation, a great resource. Hopefully, I wish you best of success in sort of your tour of conferences over the next while, and hopefully we'll certainly get a chance to meet you at our conference. And again, if anyone else is looking to attend a conference that Adam's going to be at, ours is going to be in Montreal this year, October 22nd to the 23rd, so it'll be a great opportunity to connect there. All right, so thank you very much. I think we are going to wrap up. Just to let everyone know, we do, of course, do our webinars every Wednesday at 11 a.m. Eastern Time, and it's great when you can watch live as your questions and comments really enrich the discussion. But when you can't watch live, we do always record these sessions and make them available after the fact. Next week, on September 20th, we will be, our next session will ask the question, is Canada cited sufficiently on the importance of grief in children and youth after the death of a loved one? And we're going to be welcoming back someone who's familiar to many in the CAFC community, Sir Al Ainsley-Green, the former Children's Commissioner for England. And the focus of the session will be to identify whether healthcare providers are paying sufficient attention to how the death of a parent or a sibling or other major grief event impacts surviving children. Sir Al will be joined by Alison Penny, who coordinates the United Kingdom's Childhood Bereavement Network, to share their experiences in addressing the needs of bereaved children. And then following that, on September 27th, we will be hearing about pediatric clinical deterioration, when things go from bad to worse, parents and providers working together. And we're going to be hearing from the personal experience of Sabina Robin, who's now with Patients for Patient Safety Canada, to talk about what happens when clinical deterioration has failed to be recognized. And we're going to be welcoming Dr. Chris Parshuram and Kristen Middaugh from SickKids to talk about their methods for identifying the pediatric early warning system, the PEWS system. And we'll also be welcoming Joanna Noble from the Health Insurance Reciprocal of Canada, HIROC, which she's with the Healthcare Risk Management Department, and to talk about the importance of identifying clinical deterioration as early as possible. So some great sessions coming up. And again, don't forget to check out the CAFC conference, which you can find more information at conference.cafc.org or just by going to our website, cafc.org. So hopefully we'll see everyone back here in the next couple of weeks for our webinars, or we'll get a chance to meet in person in Montreal. Thanks again for coming today, and we hope to see you next week. Bye, everyone.